If you're a personal trainer who has a client in shoulder pain, you're going to want to like, subscribe, and check out our certifications. There are 17 muscles of the shoulder, 4 rotator cuff muscles, 4 joints, 3 bones that we're going to focus on. We're not going to review that in today's video. We're going to talk about the assessment process, screening, if you need to refer out to your team physical therapist, some soft tissue techniques, and then some corrective exercises. Here's Miss Megan. Let's pretend she has right shoulder discomfort. So we're going to do the screens and the soft tissue on the right side. We're going to use her left side as the good side. So let's pretend a client comes in and you're assessing them. You find out they have shoulder discomfort. Can you help them? What is in our scope? The difference between chronic pain and acute pain. If a client were throwing a football around yesterday and they heard a snap and they come in and their range of motion is significantly altered, that's when you want to refer out to a physical therapist. If a client has radiating pain, numbness in their pinky, their ring finger, that's when you want to refer out to a physical therapist. But there's a lot that we can do as personal trainers with soft tissue and correctives that will get your clients out of the discomfort. If, for example, you have a client who's a painter, they're constantly overhead, or maybe they slept on their arm wrong, these screens that we're going to show you can eliminate what we can and cannot do. We have Miss Megan. She's our instructor for SUF-CPT here in Santa Monica. If you want to become a qualified trainer, come check out our classes in person and online. Discomfort. I say discomfort because pain has a negative connotation. And that's why we want to review the biopsychosocial model of pain. Finding out when it started hurting. What's her history with this discomfort? The easiest screen that we can do is just to see if your client can put their hands above their head. So Megan, can you do that? Great. So she can get her arm to almost 180 degrees. There wasn't any grimacing on her face. If she were to be like, yeah, there's a little discomfort, it just feels a little wonky, that is still okay. We did a seminar at Equinox because that's where she used to work, and we were working with one of the trainers there. There's a really neat interaction. You can watch the whole video in our platform. And his arm is unable to come above 90 degrees because he tore his supraspinatus. And that's exactly what we're screening for here. So if they were to go like this, or they cannot get their arm up there confidently, then we want to refer out to our physical therapist. We want to stay in our lane. That is the first screen. The second screen is being able to put your hand and touch your scapula, the opposite arm, and can you raise your elbow above your clavicle? Can you smell your armpit is what we'll say. And for clients that can't, they won't be able to come above the midline. It's a significant difference. And again, if there's a grimace like, yeah, I feel it in there, that's okay. We can work with them and try the soft tissue techniques. The third technique, I'm going to have you face the wall. Put the back part of your hand on the small of your back. Can we lift it off? As she can here, that is the third test that she passes. So she's negative on those 3. Remember, positive is bad. If you have a client that's really musculature, we were at a seminar in Atlanta and there's this jacked dude. He's been a trainer for like 25 years. He didn't have shoulder pain, but he could not get his arm off his back because of all the muscle that he has. That's okay. I'm not scaring my clients with clients who don't have shoulder pain. So I wouldn't do this screen and say, oh, you can't get your hand off the back, you're going to be in pain. There's no evidence to support that. We are not fear-based. We're pro-movement. And so she passed 3. The last one is the break test. So we start with the good arm. So I'm going to have her left arm over here, internally rotate, good. And I'm going to have her go through scapular plane of motion, scaption, and I'm going to apply light pressure. I cannot emphasize enough light. We're not trying to push so hard that we hurt the client's shoulder. So again, this shoulder does not hurt. She drives into me just so she understands what the test is going to be like. Now we're going to do it to the side that has discomfort. Empty beer can test is what they call us in physical therapy, and you're going to drive into my arm. She passes, she's okay. If she doesn't have a lot of strength, again, that's all right. What I would not want to work with is if she were to come in and she has to move back, ow, oh, that really hurts. That's a bad sign. Could be one of those rotator cuff muscles, something else. I don't know, I'm not a doctor. That's when you're going to refer out to your team physical therapist and or doctor. You should have them within your network as a qualified medical professional because we are. Trainers who are qualified should have a physical therapist, chiropractor, physician, concierge, medical team. You have your registered dietitian. You want them on your team, so you're looking out for your client's best interest. She passes. She's good to go. Now let's check out these soft tissue techniques. It's always easiest to find the scapula on clients who have razorback tees like this. You could do it over a sweater. Anytime you work with the client manually, you need to have them sign a waiver. And that is what we have with our soft tissue certification. You have your client sign the waiver first. We're not manipulating a joint. We're not going to be moving the shoulder around. We are going into the infraspinatus, and that can be identified by looking at the inferior angle of the scapula. So we got Skelly over here. We got Megan over here. The spine goes straight down. This is going to be T2 down to the mid part of the thoracic region. You got two scapulas, and we're going to find the lower angle. And then we're going to palpate. And then we're going to find a sensitive area and apply pressure. We're not massaging. We're not massage therapists. We're not doctors. We're not physical therapists. We are finding a sensitive area, and we're going to bring the discomfort level up to a 6 or 7. You're going to hold there. The initial reaction is going to be a sympathetic response. Heart rate's going to shoot up. So you need to calm down, breathe deeply. The breathing is really important to bring the discomfort down to a manageable 2 or 3. How long you hold on that spot, that sensitive area, depends on the client's comfort level and how they're handling it. You don't want to just start gnawing into your client and making it an uncomfortable situation. You've seen those Instagrams and YouTubes where people are doing some really aggressive techniques. That's not what we're doing here. We're finding a sensitive area, you hold, and then you release. Now, where that sensitive area is, she or he will tell you by looking at them in a mirror. You can't see your face right now, but we're going to flip around so you can see. You're going to use your thumb. You're going to find an area. You're going to brace yourself in front of the client. You always ask permission before you touch them, and then you're just going to apply pressure. If you don't have great grip strength, you can have your client sit down to leverage them. Be super respectful of your client's chest area and where your arms are. If you get a vibe from your client that they don't want this to be done, you don't have to do it. You can go right into the corrective strategies and the mobility drills. I'll have your face there. So I'm gonna have her face you, and then we'll have another video that you can see a close up. And you're gonna see when you find that spot, your client is gonna give you a little bit of a grimace. Breathe through it. It's very common to have deferred pain down the arm. There's a very common to have some shooting. No, I don't want that. You're going to hold for 15, 30 seconds and then communicate with your client. Let me know when it comes down to a 2 or 3. When they let you know, you can either find a new spot or you can press a little bit more to bring her back up to a 7. You hold and you repeat for 2 to 3 rounds. How's that feel? Good. So you're going to see, I'm going to get into this area. You're just going to apply that pressure. Be careful of your nails. You don't want to be driving into your client like that. You're just going to use your thumb to apply the pressure on the infraspinatus. You find the area. So where is that sensitive spot? It depends. Most of the time, it's going to be superior and lateral to the inferior angle, right where that X is, but it depends. You may find a spot there, you may find it up here. You're going to move your fingers around until you get that sensitive area, and then you start with the parasympathetic breathing. After performing 1 or 2, there are 5 soft tissue techniques. We just showed you 1 today. Then we're going to do a mobility drill next. I love the foam roller on the wall so we can get the protraction. The scapula has 8 actions. Maybe that discomfort is coming from the scapula not moving optimally, what we call dyskinesis. It's just sitting down, it's depressed, and we're not taking it through all of the actions that it wants to perform. So Megan, put the foam roller on the wall. Your elbows are going to go on the foam roller. We want full protraction, and then you're going to drive up. And you're going to not drive through your traps, and you're going to bring it back down. So this is just getting the scapula to move. This is the mobility drill. It's creating some stability in there as well. Doing anywhere from 5 to 8 repetitions. You're going to choose 1 or 2 mobility drills, and then you do 1 or 2 stability drills. Then you get into the rest of your programming with the CCA we teach. I'm going to show you 2 of my favorite stability exercises. grab a band, orange or red, make sure it's light, put it around the wrist, and I'm gonna pull the client in. So we're gonna work on upward rotation and elevation, and then when we come down, downward rotation and depression. We're complementing all of those actions that the scapula likes to do. So a little bit of resistance, bring it back, and now she's gonna press up and really reach up, and you can even get like a side bend in there if you wanna reach over, that's okay. 8 to 15 repetitions. You don't wanna make it so fatiguing that we're gonna compromise the force production for the rest of the workout. Check out your client. If they give you any type of grimace, then we want to avoid this exercise for the time being. But that's what the soft tissue technique does. It makes them come into a good, comfortable spot so we can start moving pain-free so we can get into the rest of the workout. These are called Waterbury holds. Doc Chad Waterbury, he's on our team. We consult with him regularly. This is one of his favorite exercises to hold up to a minute. Once you can get there, then move up to the red one, the brown one, black one. Just keep on progressing up, holding isometrically. So if you can make it a little more challenging, get that full. You want to drive your scapulas into the ground. If you want to have a little bit of trainer engagement in there, you can pull down a little bit. But this is a great exercise to create that stability. If you're a trainer struggling with getting your clients out of pain for shoulder, hip, low back, or knee, check out my book, How to Become a Successful Personal Trainer, Volume 2. It gets into the anatomy, how to build a book of business, how to network with other medical professionals so you can build that team, and what you can and cannot do within our soft tissue certification. We have our certification for life, as well as a nutrition certification. If you want to become a qualified personal trainer, check out those certs. Get to a hands-on learning seminar. We've partnered with Lifetime and Equinox, the best gyms in the world, accept our certification because they recognize the importance of becoming a qualified personal trainer. Remember, big biceps are better than small ones, and keep showing up.